Hi everyone, my name's Sarah, and for my individual recorded presentation, I chose to focus on healthcare justice with drug exposed children. Giving a little bit of a table of contents. First, I'll discuss the background, I'll move into the organization overview that I chose to focus on. Next, the legal system impact, the role of the social workers in this organization, and a summary of my whole presentation. So let's get started. So first, I wanted to give background on the opioid epidemic itself. Obviously, this is like the overarching issue within a child being drug exposed. So there are 3 waves of the rise in opioid overdose deaths. The first wave started in 1999 due to the increase of prescribing opioids in the 1990s by doctors. And then the second wave was the rapid increase in overdose involving heroin. And then the third wave was a significant increase in overdose deaths involving synthetic opioids like fentanyl. So I have this little graph up here. This is from the CDC, and I think it's a great visual to show these 3 different rise in opioid overdose deaths. As you can see, this epidemic has been going on for quite some time. This graph stops at 2019, but obviously now being in 2025, we know there has been a significant increase in recent years. But I thought this would just give some nice background for the beginning of the opioid epidemic. Now moving into some more background about the opioid epidemic. More than 565,000 Americans have died of an opioid-involved overdose between 1999 and 2020. Obviously, that's a huge number. It's very significant, and it's also very sad to think about. But even though with that high number and the waves, like I just mentioned, starting in 1999, the opioid epidemic was not officially declared a public health emergency until 2017. So it took a while for this to become a national issue and not just an issue in certain areas or in certain communities, like a rural community or like a city. Currently, we are in the 4th wave, which is differentiated by the use of multiple substances at once. This is also called polysubstance use. So an example of that would be cocaine and fentanyl, or it could be methamphetamines and fentanyl. It's kind of just that combination of multiple things at once. This also has to do with more drugs being laced with fentanyl, either knowingly or unknowingly. A lot of times people will have fentanyl in their system without even knowing it and not even being aware that they took fentanyl. Moving on to the background specifically for drug-exposed children, there's 2 different terms that are kind of with this population. The first is NAS, which is neonatal abstinence syndrome. This is a diagnosis given to children in the NICU. This means that they are withdrawing from drugs from their mothers in utero. And what is different from NAS and IUDE, which is intrauterine drug exposure, is with NAS, babies have to use medication to withdraw from the drugs they were exposed to, whereas IUDE, they might still be in the NICU, but they might not have to use medicine to withdraw. Within these pregnancies, there is a higher rate of little to no prenatal care, which also has a huge effect on these babies. There's also a higher chance of early delivery, low birth weights, low head circumference, birthing issues. Also results in longer NICU stays. And this is typically because of the medication, which I'll go into in a second. And then long term, there's developmental delays and behavioral issues. And those developmental delays can be anything from sensory concerns to speech delays, feeding delays. A lot of drug exposed babies have GI issues, they have some eye issues. And then as they get older, we see more of those like behavioral issues in school. They just need more input if it's sensory, and we see more of those behavioral issues come out as they get older. Kind of jumping back to the NICU, the common medicine used in NICUs for NAS withdrawal symptoms are methadone, morphine, claudine, and phenobarbital. And then I have another graph on the side, which is from the state of Tennessee, and it's the rate of NAS between 2013 and 2021. In this report, it did say that 2021 was lower due to COVID. But it kind of just shows the rate of NAS cases per 1,000 births and how it has, like, it decreased a little bit, but it's still very high. Being on to the current state, more and more babies are being born drug exposed each year. Many states do not have a specialty clinic specifically for drug exposed children. This has major impacts on children later in life because they do not get early interventions a specialty clinic might offer. And with the lack of medical care, many children struggle in school with learning disabilities or behavioral issues. So the organization I picked is Grow With Me. It is a specialty clinic at East Tennessee Children's Hospital. It is a developmental follow-up clinic for children that are born drug exposed and or have been diagnosed with NAS. So the criteria for this clinic is they have to be born at 35 weeks or beyond, and they must have been exposed to an opioid. Currently, they do not allow a baby that has just been exposed to THC or marijuana into the clinic. It has to be a more severe drug like methamphetamine, cocaine, heroin, any form of opioid, and fentanyl. It serves drug-exposed children ages 0 to 5 with the goal to keep them in the program until they start kindergarten, kind of to see if there are any behavioral concerns, make sure that kids are getting an IEP if they have learning disabilities and are getting some more help. They do have some behavioral concerns. During the clinic visit, a patient is screened for developmental delays by an occupational therapist, speech therapist, dietitian, psychologist, and a nurse practitioner. It's a big visit, but it is very expansive and very thorough. And if any from those screenings, if a child is in need of a therapy or any other service, they can be referred through Grow With Me. So that means they don't necessarily have to go to the pediatrician. They can get the referral there. On a more broader level, Grow With Me advocates for specialty care for the specialty care for drug exposed children need during the early years of life. As I've mentioned, those are really formative for how children will behave and how they'll learn later on. So it's very important to have the early intervention. They also advocate in the local community why a specialty clinic for drug exposed children is so important and necessary. Moving on to the legal system impact, there's very little conversation or change happening in the legal world to advocate for drug exposed children specifically due to the lack of research being conducted on this population. On the flip side, relating to the civil court system, mothers who do expose their children to drugs during pregnancy are given a finding of severe child abuse, and many times this does result in their infant being placed in the care of someone else obviously in the hopes that the mom will go get help and be able to regain custody of their child and be a great mom that they can be. Um, Regarding the opioid epidemic itself, the Biden administration has awarded $1.5 billion to all states and territories to help beat the opioid crisis and support those who are in recovery. They've also given funds to increase access to recovery supports and expand substance use treatment and prevention in rural communities and create better access to naloxone products, which is the spray that medical care professionals and now police officers have that can help someone from overdosing. There is not a lot of research on drug exposed children because it is such a hard population to conduct research on. Obviously, they are kids. There's HIPAA laws that have to be followed, which makes it difficult to do research. And also, if these children are in the care of their parents, it can be a big privacy issue if these parents want their child to be known that they are drug exposed to the world, pretty much. Even though their information would be private, it still is kind of a feelings thing, and if they do want their child to have or be a part of a research project. Obviously, this results in limitations in how far the legal system can currently help these children from getting any help or support they might need, or seeing any change on the federal or state level. So, moving on to the role of social workers, currently Grow With Me is ran by social workers. Social workers are the program coordinators and oversee the entire program. Some of their duties include contacting families in between visits to check on them and their needs, make sure that their kids' therapies are going well. If they do have concerns, talk it out, or have one of the people, like an occupational therapist, contact them and give them advice. Also coordinate with the NICU for newborns who are Grow With Me eligible, and making sure that whoever is taking that child home is aware of their appointment and that they are there for them if they need anything before that first appointment, and just kind of what Grow With Me is about and why it's so important that their child is in the program and stays in the program. I help apply for grants for Grow With Me and make referrals for patients that need therapies. The social workers have an LMSW or an LCSW, and they also must have some medical knowledge about development and the NICU, and kind of understanding the effects of the drugs and what medicine is used in the NICU to help the babies go through withdrawal. Having a forensic social worker who specializes in the healthcare legislation could help apply and receive more healthcare related grants for the clinic. They'd also be able to advocate for NAS specific clinics on a broader level, and also advocate for more reform to help end the opioid epidemic. An ethical dilemma that you might face is if a child needs a therapy and their guardian does not want them to be referred for a therapy. So it's a huge thing as a social worker. We want to help everybody as best we can and make sure they have all the resources they need, but sometimes a guardian might not want that and might not want to accept a therapy or a referral, which is a dilemma because ultimately it is up to them because they are in charge of the child and their care. And finally, just a summary, kind of going over everything. Many children are born drug exposed each year due to the growing opioid epidemic. The exposure results in children being diagnosed with neonatal abstinence syndrome, or NAS, which can cause major developmental delays. Grow With Me is a specialty clinic for drug exposed children ages 0 to 5 to screen them and make sure they are getting any therapies or resources they might need. The role of the social workers in Grow With Me's care coordination for all the patients and family, coordination with the NICU, apply for grants, and make referrals for various therapies. Having a forensic social worker could help gaining more grants, advocate for more NAS specialty clinics on a macro level. Currently, there are not a lot of clinics like Grow With Me. They're very sporadic throughout the country, and most of the time these children are just referred to a developmental follow-up clinic and on a clinic specifically for the delays that are seen within this population, and people who specialize in the care for drug-exposed children. And also they could help advocate for reform for the opioid epidemic on a macro level with the knowledge and findings they learn from working in a specialty clinic like this. Currently, there's some change happening to help the opioid epidemic, but there's not really a lot being done to help drug-exposed children. But hopefully in the future, with more research, there will be. I hope everybody enjoyed my presentation and learned something about this injustice. And yeah, thank you.